If NCLEX questions feel random or overwhelming, that's normal. Most students were never taught how to think before answering, only what to memorize. This video fixes that. Most nursing students try to survive by memorizing diseases, symptoms, and lists. That works until the questions looks unfamiliar. Then every answer suddenly feels right or wrong. NCLEX does not test how many conditions you recognize. It tests whether you can recognize what changed in the body. Once you understand the change, the condition almost doesn't matter. They read the question, then immediately jump to the answers. That's backwards. You should think before you look. Before you touch the answers, ask question. What changed in the patient's body? Not the diagnosis, not the symptoms, the change. This is the thinking order NCLEX rewards. First, what system is affected? Airway, breathing, circulation, neuro, metabolic. Second, what changed? Up, down, blocked, leaking, failing. Third, what must happen because of that change? And only then, what does the nurse does first? You do not need the diagnosis to think correctly. If oxygen goes down, the body reacts the same way, no matter the label. This is why strong test takers can answer questions they've never studied. Once you understand the change, you can predict what you should see. This is why memorization feels exhausting. You're trying to remember hundreds of conditions when NCLEX is testing a handful of physiologic patterns. Same thinking, different question. This strategy works for priority questions, data, delegation, unfamiliar scenarios, because you're not guessing, you're reasoning. This is NCLEX strategy number one for a reason. If you skip this, every other strategy feels harder than it needs to be. All future videos build on this. If this made NCLEX questions feel more organized, that's the goal. Watch strategy 2 next, where we break down how to identify primary system failing. Once you see that, NCLEX starts to slow down.